We roll back again and say, I
Yeah,
have some questions. Can we fit that in somewhere?
yeah. Well, matter of fact, let's just do this. Let's run down a few of the most common questions people normally have about diabetes. That when they come to the office, like what do they normally ask you about, right? Or what their normal
Yep.
concerns are. So run through a few of those, okay? Uh,
Run through a few questions that are normally
yeah,
asked.
yeah.
Okay.
So the most frequently asked questions that they normally have to you about diabetes, and your question you just asked me, include all that in there. Okay. So
Okay.
I'm rolling again, so you can start with.
So which one you want me to do first? The questions or
Do,
my questions on
yeah,
today's lesson or the question that's commonly asked with the patient?
do your question first, and then after that, do the most commonly asked questions.
Okay.
Okay. So
Okay.
when you ask it, make sure you answer your own question. So since
Uh,
nobody's there.
yeah.
All right.
Okay.
All right. So start whenever you're ready.
Okay. Okay, so on today's session, I know we learned a lot, but I want to make sure that you are paying attention. But more importantly, I want to make sure that you have the information. So, with diabetes, that is currently the only diabetes that we are not able to do preventative care for. What's the only diabetes that we cannot prevent as of now? Have that question? Well, I'm glad you asked. I have an answer. So that's going to be our type 1 diabetes because remember, the type 1 diabetes, it is the pancreas not making the insulin. So if it's not making the insulin, and we really don't know why, even though it's thought to be an autoimmune issue, it's that body fighting against the islet cells inside the pancreas, and that's what we are caused to believe that's happening. So if we don't really know what the problem is, then we can't prevent what we don't know. So as of now, there's no research to say or that can explain why type 1 diabetes happens, so we can't prevent something that we don't know. Okay? Good job. If you said type 1, that means you were listening. All right. I have two more other questions. Which population is more at risk for type 2 diabetes? And what's the percentage of that? All right. I know y'all are thinking, and I know you have the answers. I'm proud of you for listening. You're right. If you said African American populations are at greater risk for type 2 diabetes, and they have a twice as much chance than the white population in getting that. And again, we talked about that. It just could be the fact that they are not knowledgeable about the information, but they don't have access to the healthy foods or either places to go and be active and work out and things like that. So, yes, the African American population is twice as much to get diabetes, type 2 diabetes, in the white population. All right, one more question. What is the secret that states that this particular spice acts as the pancreas does in the body and allow the blood sugar to be lowered? But this would be more natural. What is that spice that we talked about? I know you're thinking. Great job if you answered cinnamon. Yes, cinnamon is our spice that resembles the work of the pancreas in producing the insulin to provide us with that low blood sugar effect. So great job. Now, I like to go over a couple different commonly asked questions from my patients that come in. So some of the common questions that my patient asks when they come in is, do I have to be on medication for this? That's the commonly asked question. Do I have to be on medication for this? And the answer is there are alternative ways to lower your blood sugar that we talked about. So I tell them my first move is to always do lifestyle changes and to make sure that they're putting in the work, because if they're putting in the work, I'm very confident that they will get their blood sugars under control, and most likely they will not need insulin, or they will not need diabetic medications or anything like that. So that is the common question we hear. Do they have to take medication? Another thing we hear is the complaints about, I feel I have to pee all the time or go to the bathroom all the time. Well, that's part of the symptoms that we talked about. You're going to have to pee a lot. You're going to eat a lot. You're going to have to, drink a lot. And that's just a part of the symptoms that we see in diabetes. So, yes, we commonly see those things. So, it's not surprising that they have to go to the bathroom a little bit more than they are normally used to going before this. Um, and another question that we commonly hear in healthcare is, does this mean that I'm going to have to cut my leg off, or is that mean that any of my limbs are going to get cut off? Yes, but only if you don't control your diabetes. Okay, so yes, that is possible if you go without doing what you need to do in order to manage your blood sugar and keep that under control. Because again, we talked about how unmanaged or uncontrolled blood sugar causes issues with those blood vessels, and that can definitely lead to a host of other issues, as we said, heart attack, stroke. It also can lead to blindness, and it also can lead to amputation. So yes, it can lead to amputation, but it doesn't have to. That all depends on the patient and how much they want their limbs. So I hope this was very helpful, you guys. Again, my name is Dr. Hinton. That's Hinton, period.
And cut. That was
Okay.
awesome. Okay, I think we got plenty.